Hello, and thank you for joining us at CAVOCUR for your infection prevention webinar. I am Nicole Giesey, and we're going to walk through the basics of infection prevention and also how to prevent infection from occurring. So we're going to talk about why is infection prevention so important, cross-contamination prevention, instrument reprocessing, infection prevention lead, and how to move forward. So why is infection prevention such an important topic in a dental setting? Both the patients and dental healthcare professionals can be exposed to the pathogens that we come in contact every day through blood, oral and respiratory secretions, and contaminated equipment. And we need to enact with proper procedures to prevent the transmission of infections on both us, the dental healthcare provider, and also our patients. To do this, we need to make sure that we're practicing standard precautions. Standard precautions are the minimum infection prevention practices that apply to all patients, regardless of suspected or confirmed infection status of the patient in any setting where dental procedures are delivered. We used to call this universal precautions back in the day, and the verbiage has changed to standard precautions. Basically, no matter who you see, you need to pretend that they have the worst disease possible. Every single time, every single patient, no matter if they're your family or friends, if they're young or old, everyone should be practicing on them with standard precautions. Why is this? Because 1 out of 5 patients you see today will actually have something, and they will not disclose that just because of fear or embarrassment. So 1 in 5 patients usually have a virus such as flu, herpes, HIV, bacteria infections such as staph, strep, and MRSA, fungi, or parasites. And how do we get this? So direct contact with blood or body fluids. So that's, if we have a rip in our glove or something like that and we're in the mouth, you can get it right there from that kind of contact. In direct contact with a contaminated surface or instrument, this is a huge touch point when we're doing instrument reprocessing. Contact of the mucosa of the eyes, nose, and mouth with droplets or splatter, and an inhalation of airborne microorganisms, all those aerosols we're creating when we're using our high-speed handpiece and also our Cavitron unit. How long could a virus even stay on the surface? This is a pretty huge eye-opening chart. So hepatitis A could be on the surface for months, Hep B for 7 days, Hep C 16 hours to 14 days, and Hep C is a big one that we always try to make sure we don't even come across. COVID-19, 2 hours to 9 days, MRSA 6 to 8 weeks. The flu is a 48-hour stay on a surface. Herpes is a 2-hour, and rotavirus is 2 hour. So you can see that there is definitely reason to make sure that we're doing the right precautions to not come in contact or to kill these viruses on the surface. So how do we do that? One way is to use personal protective equipment. So personal PPE or personal protective equipment is a major component of our standard precaution. So it protects the skin and mucous membranes from exposure to infectious material in spray, surface, or spatter. It should be removed when you leave the treatment area, and then it should also be put back on when you're going into a sterilization area. In this picture, you could see that the dental healthcare provider, an assistant or hygienist basically, is using a heavy-duty glove while they're cleaning the instruments. So examples of our personal protective equipment would be gloves, heavy-duty gloves that as you had seen in the picture before. We have latex, nitrile, or neoprene gloves, our masks, gowns, and then eyewear. Also face shield. So we have goggles and we have face shields as well. So what is another way that we could prevent this transmission in infection prevention would be hand hygiene. So hand hygiene is actually the single most critical measure for preventing pathogen transmission, and it's between all different sources, between us and our patients to patients within the office, our staff, and we don't want to bring it home to our family, and then also if the patient picked up something in the office, they don't want to bring it home to their family. The CDC actually says that an estimated 88% of infections, and I'll say that again, 88% of infections in hospitals are due to poor hand hygiene. That's alarming. Picture are some products that are hospital grade disinfectants or hand soaps and also hand sanitizer. So that's a good point to have, and we'll talk about that later on about the difference of hospital, healthcare, soaps and hand in hand sanitizer versus something that you would buy at the store. And so when do we need to wash our hands? So this is a little different than everyone at home. In the actual dental setting, we need to wash our hands specific times. So the very first thing when you come into the office, it's not just a typical hand wash. The very first hand wash of the office is not only your hands, but it goes all the way to your elbows before you put your PPE on. That's the first thing in the office. You also would go throughout the day and wash your hands if they were visibly dirty. After you would touch a contaminated object with bare hands. Before and after patient treatment. You would do it before eating and also before you go home. So before you go home, again, would be all the way up to your elbows. That's where you would be washing your hands. So soap and water and action. So you could see on the right side, the areas that people would be typically missing when they wash their hands. So it's typically their tips of their fingers, the palms. Those are the areas that they're missing. And then on the left side, you could see the difference between not properly washing for the whole 20 seconds, and that's actually distributing a 30-second. So on the 6 seconds on the picture, you could see the white spots, and that's where they missed when they were hand washing. So like we said, at home, these are the typical products that you could buy, and it's perfectly fine at home. But you really don't want to use these inside the office. They don't usually have emollients, which protects the skin, and they may not be designed to integrate properly with your gloves. So they actually might break down the gloves, and so you definitely don't want to do that because that's part of your PPE that's protecting your hands underneath. So as we talked about our hands, it's the types of dermatitis. You could see on the right side that according to WHO, the guidelines on hand hygiene and healthcare, the first global patient safety challenge, clean care, is safer care. There are two major types of reactions for hand hygiene. First and most common type is contact dermatitis. So you may have had it. It's dryness, irritation, itchy, even cracking and bleeding. And the second type is an allergic contact dermatitis. And those symptoms are similar to the first type, but they could also be associated with respiratory distress and other symptoms of anaphylactic. Now, not only does this happen with hand hygiene products, but sometimes the accelerators and gloves could also cause this type of reaction, but it could be the accelerators and the gloves mixed with the products that are sold at the stores instead of getting a healthcare type of product. Another thing you could do for hand hygiene in between those hand washing would be an alcohol-based hand sanitizer. And the benefit of that is that it's an effective antimicrobial action. It maintains skin condition, and it's more accessible than sinks. The limitation is cannot be used if hands are visibly soiled. Now, I will say that not all alcohol-based hand sanitizers are created equal. A lot of them do not, again, it depends on where you get them, but a lot of them do not have those emollients in it. So if they do not have the emollients, then you may have the same reaction as we saw prior with this type of dermatitis because it's pure alcohol with no emollients that help the skin get moisturized. So that's two things of how to prevent cross-contamination in the office. So the PPE, the hand hygiene, and now we're going to move into surface disinfection. So how are we speaking about surface disinfection? First, we kind of have to define the three key things when it comes to cleaning, disinfection, and sterilization, because these words are kind of used interchangeably, but they distinctly mean something different. So cleaning is the process of removing unwanted substances such as dirt, infectious agents, and other impurities from an object or environment. So when you hear buzzwords like pre-clean or clean the surface before you disinfect, basically what you're doing is you're removing the debris off the surface, so then your disinfection, which is the killing of live bacteria and viruses, could actually interact with that surface. So you have to clean it first and then disinfect. And then the last term we're going to talk about is sterilization, and that is effective against all organisms, including bacterial spores. So that's our end stage in dentistry. And what do we refer to when we talk about cleaning, disinfection, sterilization? So we're talking about these these terms sometimes get interchanged the wrong way when we're talking about what has to happen with certain things. So like instruments have to be sterilized. But the dental chair can only, it doesn't have to be sterilized, obviously. It should be disinfected. So just so you know the terminology and how they're interacted. And then also, if you want to refer to your Spaulding hierarchy, and you could see examples of different critical, semi-critical, and non-critical items and what process they have to go through in the disinfection sterilization process. And how do you do this? So when you're talking about disinfection, the number one thing you should look at is the label. A surface disinfection should, first of all, meet CDC guidelines. It needs to meet the needs of the practice, meaning what kind of equipment do you have? Is it compatible? Every equipment has an instruction for use, and it spells out specifically what you could use to disinfect and clean that product with. So then you want to make sure that chemically your disinfectant is meeting the needs of your equipment. The kill time. So if you have a product that has a 10-minute kill time, do you have time in your practice in between patients to really get that 10 minutes? Or do you need something faster, like a 3-minute kill time? Also, do you need an intermediate level disinfectant? Do you have sensors in your office? And those, by law, need an intermediate level disinfectant. So you want to make sure that the disinfectant has a TB kill claim, making that an intermediate level. And then lastly, is it a cleaner and a disinfectant in one, or do you have to get another product to clean beforehand? So this is a great chart that I love to refer to all the time, the pathogen resistance to disinfectants. So if you look on the left side, there's a list of all the organisms. On the very, very bottom is coronavirus. So they start at the bottom as how easy it is to kill, working all the way up to bacterial spores. And if you go over to the right, you see that the only thing that's going to kill spores would be sterilization. So if you go all the way back down to coronavirus, you could see that technically even an EPA hospital disinfectant, CDC low-level disinfectant would be able to kill those type of organisms. Now, right now, for coronavirus, the CDC had recommended an EPA hospital disinfectant with tuberculosis claim. See how high it is above the coronavirus. So if you look at the hierarchy of pathogens, and then you go to what kind of level of disinfection or sterilization that's needed to kill those pathogens, you could easily figure out what type of product you could use in your office as recommended by the CDC and guided by the EPA labels. So what does the CDC recommend? How do I use my product? So the CDC recommends spray, wipe, spray. And the first spray, like we had talked about before, is the cleaning process. So it's getting all that debris right off the surface, but the spray does not remain. The spray is a quick spray, and then you wipe it off real fast. You don't have to wait for the spray. You don't have to wait for the kill time. This is just to remove the debris, to get your surface ready to be disinfected. So you spray first, clean, and then you spray again, and you let it sit for the manufacturer's kill time. And the biggest thing with the spray is because it's a liquid, you don't want to pour it on a 4x4 and keep it in a glass jar. It'll break down the disinfectant. It's not recommended by the manufacturers, and it certainly doesn't have a proper EPA label. So you don't want to do the 4x4 saturation. However, you could spray and use a dry 4x4 and wipe and use that as the wipe. The other option with disinfectants is to use our wipes or any wipes. You would wipe, throw that wipe away, wipe again, and then let it sit for the kill time. So it's the same process of wiping one time to clean, discard that wipe, and using the second wipe to disinfect, and then let it stay on the surface for the kill time. And then what you really want to make sure is if you are using a spray and you're also using a wipe, you don't want to use two different chemicals. So even if you're using something that is manufactured, let's just say by a house brand dealer, you want to make sure chemically they're the same. Some companies have wipes and they have a spray, but chemically they're different. So you want to just ensure that chemically you're matching up your spray and your wipe. And here's just here's an illustration of how to do that spray, wipe, spray, or that wipe, discard, wipe. Please note that we strongly recommend that heavy duty gloves are utilized during these processes of any instrument reprocessing or cleaning of the operatories. And in these pictures, nitrile gloves are being used. So what are some other ways to prevent cross-contamination? One big one that I have always seen in the offices is bib chain cross-contamination. As we have all the buzz right now about aerosols, if you're using a metal bib chain, those aerosols and contamination in the spatter can go right inside that bib chain. Even if you spray it, it doesn't get thoroughly cleaned or disinfected. So what better way than to just literally get a disposable? They're very inexpensive, they're very strong, and it totally negates the cross-contamination. So bibbies is a great example of how to totally eliminate the cross-contamination for the bib chains. Another way to reduce contamination is through barriers, especially if you could see on the right, the air-water syringe. So the air-water syringe buttons is a high hot point for contamination in the operatory. So using a simple barrier right over that air-water syringe would also get rid of the potential of cross-contamination in those buttons. And it's super easy. So you just literally put the barrier on, making sure it's a medical grade barrier. You don't want to use a saran wrap. You don't want to use tin foil. You don't want to use a barrier that does not have the medical grade clearance. You want to utilize a barrier that you want to make sure that microscopically there's no aerosols coming through that barrier contaminating, to completely eliminate the reason why you're using it. So application of barriers covers to prevent surface from becoming contaminated, and also cleaning and disinfecting environmental surfaces after contamination occurs. Now, I will say, if you're using a barrier on, let's just say this air-water syringe, and something happens and you have a little hole in it, you want to make sure that you're disinfecting after barrier use. So whatever you're using a barrier on, you want to make sure that you're inspecting the product that you use the barrier on afterwards. Let's just say a dental chair. Perhaps the patient had a belt or something that put a hole in there. Just make sure that the barrier was not compromised, because you would have to disinfect after. Now, these are for barriers that are used on non-critical items, but barriers that are used for, let's just say, a sensor or a composite curing light, anything that goes intraorally in the mouth, you have to make sure that you're disinfecting afterwards. So if you're using an X-ray sensor and you're putting that obviously in the patient's mouth to take, let's just say, a bite wing, when you take that out and you take the barrier off, you still have to use a disinfectant because that product was used in the mouth. So as you can see here, the air-water syringe, the only area that would go in the mouth would be the tip, which we'll talk about the tips in a minute. But if it was a metal tip, you would autoclave. If it was this disposable, you obviously throw out. So you just want to make sure that you're understanding the barriers outside of the mouth. If they're not compromised, you're good to go. But the barriers inside of the mouth, you want to make sure that after the barrier is used, you're still disinfecting the sensor, the composite curing light, the intraoral camera, things like that. So we'll get back to that air-water syringe now. So disposable tips are definitely recommended due to cross-contamination. It completely eliminates the cross-contamination. Also because the mechanics of the air-water syringe, the metal syringe tip, inside the metal syringe tip, there's a thin lumen that can harbor live bacteria that is present after sterilization. That's right. Think about that. After sterilization, if you cross-section that metal air-water syringe, there's still live bacteria, some percentage, not the whole gamut, but there still is live bacteria. So let's just say the next patient comes and you're doing a root canal, or you're doing extraction, or the hygienist is doing an SRP, and you go to, to rinse, or you're using the air and the water at the same time. Those little pieces of bacteria, live bacteria, could potentially break off, creating a monster infection. So it would be easier for you to not even have that as a worry and utilize disposable tips to prevent cross-contamination. Waterline treatment. So waterline treatment is another hot topic. It's been buzzing for the last 7 to 8 years. So waterline treatment and maintenance, the biggest component, I will say, with waterline treatment is the testing component. So prior to implementing it on a monthly basis, you should be testing your water. So that way you could see the CFUs per milliliter that's occurring in your waterline. And then you could treat it. There's multiple products on the market. Aqualiant, we have tablets, and there's also a straw, and that includes a shock to your system. So, you know, the whole procedure of testing, treating, shocking, but the biggest component is that test to make sure you could have a lot of CFUs, you could have a different type of quality of water. When you're utilizing a straw, it's not a one fits all. It's not a 1 year and you're done. You have to test because sometimes in some areas of the country, your water may be different and you may be going through those straws a little bit faster. So you just want to constantly test to make sure you're under that 500 CFU limit. So instrument reprocessing. Instrument reprocessing is probably one of the most important areas for infection prevention to prevent cross-contamination. You're looking at a workflow right now, starting with the safety transport to the reprocessing room, all the way down to sterilization. So you could see how you go red, super dirty, and then as you process everything, it's coming out green for the next patient. So safely transporting to sterilization room. OSHA had come out with a beautiful recommendation, actually regulation, I should say, to put all your instruments on a tray with a locking lid. So the lid has to be locking and leak proof. That's to prevent so of course, OSHA is for the employees and it's for their safety. It's to prevent anyone getting hurt or getting splashed or having any kind of contamination while transporting to the sterilization room. Another thing is the optional pre-soak with Empower foam. So if you look on the right side, the biggest thing you want to do with instruments is make sure that they are never dry. So if you're doing an SRP and there's calculus on that inside of that 204S, or if you just got doing a root canal and there's some type of debris still on your instruments, you don't ever want that to dry, because if it dries, and let's put it in the ultrasonic after it's dried, that protein on those instruments are very hard to come off, even with the best ultrasonic. So the key is to get the instrument straight from their operatory to the ultrasonic as fast as they can, or we now have a solution of Empower, this Empower foam. So you can keep it in the operatory, spray it directly on the instruments like it shows on the top right. The instruments are always wet. So this is actually an ultrasonic solution in a foam form that it's compatible with your ultrasonic because it's the same solution. So you would go straight from the operatory to the ultrasonic. And if you're super busy and you're running 7 rooms and you have a ton of instruments stacked up, if you have the foam put on the instruments, you don't have the risk of anything drying. So what's the risk about? If you have a dried calculus or dried debris put through the ultrasonic and it doesn't get properly rinsed off or inspected and it goes through sterilization, the hygienist gets an instrument pack, she brings her patient back, sits down, goes to scale the distal of 15, and right on that 204S curve, there's the last patient's calculus or blood is still there. So of course I went through the sterilization process, but it was not cleaned prior to going through the autoclave. So this product, Empower Foam, really negates that and it doesn't give you any surprises. So it goes right with instrument cleaning. So instrument cleaning could be automatic with an ultrasonic cleaner, or you could hand and manual clean instruments to remove debris and bioburden. I will say that the cleaning of instruments manually is really like a faux pas. You don't really want to do that because once you have to start scrubbing instruments, your risk of getting contaminated or transmission, it goes up. It's easier for you to utilize the ultrasonic cleaner so that you're not potentially exposing yourself to a stick. So you see on the top right, the ultrasonic. Another key component is that you never really want to put your hands in the ultrasonic. That's another way to prevent cross-contamination. And also, It's another way. What if you have a faulty glove? You know, not all gloves are perfect. So it's just another way to not get a transmission there. Also, you could see that there's a beaker there. And I always talk about this when I talk about instrument cleaning, is cleaning of, and this isn't in instrument reprocessing, but it's cleaning of dentures and partials. So for any assistant or dental hygienist out there that cleans dentures or partials in a Ziploc bag with tartar and stain remover, and you do not utilize the glass beaker, you're literally exposing that denture or partial to everything that's in the ultrasonic. In the ultrasonic, we kind of refer to as the cesspool of the office. So you just want to make sure that if you have access to a glass beaker, and you would have a tray with these circles, you put the glass beaker in there, you could utilize that Ziploc bag, fill it up with tartar and stain, and put it straight into the beaker. That way you don't have a cross-contamination issue for your patients. And then you could also autoclave that glass beaker after. But that way it also prevents anything coming through that bag if you just let it free float in that ultrasonic. So let's get back to instrument reprocessing. After you go through the ultrasonic with the instruments, you want to make sure that you're rinsing, drying, and inspecting the instruments, ensuring, like we had just talked about, all the instruments are rinsed off with no debris. Visually look at them. Right here where you can see the pliers. I know a lot of forceps, inside those curves of the forceps, if anything is dry, there's usually like a nice smear of blood in there. So you want to make sure that everything is completely clean before you start getting ready to pack it. Prior to packing for sterilization, if you have any hinged instruments, it's really good for the longevity of the instrument to utilize a lubrication like a MetroLube. That way it's easy for any ortho instruments that are hinged, or the hemostats that you could see in that bin right there, any kind of forceps. After a long period of time of not lubricating them before sterilization, you know, those hinges start to wear out. So this way your hinged instruments, which are quite costly, will be able to be used a lot longer. And then we go to preparation for sterilization. All along, we're using these heavy-duty gloves. So we would be prepping them either in pouches, such as PillView on the left, or you'd be prepping them in a cassette with the wrapped instruments. Now you want to make sure when you're using the PillView or any sterilization pack, but mainly PillView is really nice because they have these dotted lines that they can show you exactly how to close them. So if you look at the bottom right, the instrument pack is closed exactly on the dotted line. That way there's no gaps for air. Some people, when they have a really big bag and they have a little tiny object going in the bag, they'll fold the bag in half to make room in the autoclave. So when you do that, you're actually creating a pocket so that the instrument inside will not be sterilized afterwards. So that's the whole key for this sterilization for pouches and also wrapping and cassette, is to really maintain that sterilization after you get it out of the autoclave or the statum. You want to make sure that the pouches are utilized correctly, and also that the labeling and everything else on those cassettes are done correctly. Speaking of the autoclave, so when sterilization occurs in the autoclave, of course, it's the destruction of all microbial life, including bacteria, fungi, viruses, and spores. So there's two ways to achieve this: through autoclaving, which you can see on the right side with that statum on the bottom and the autoclave on top. And then also cold sterile, which that is the bin on the right side. When you're utilizing cold sterile, if you're using a glutaraldehyde-based cold sterile, you want to make sure that you're utilizing a test strip every time before you use it to make sure that glutaraldehyde level is at the right concentration. There are some cold sterilization products, such as Compliance, that's an acid base, and you do not have to test that. You're mainly testing for the active ingredient of the glutaraldehyde. So you have a glutaraldehyde-based cold sterile, and then you have an acid-based cold sterile, and you do not have to test that acid peroxide base. So let's sum this up. Infection prevention for your patients. So what could we do? We could build credibility. We could help create a safe environment, not only for your customers or patients, but for yourself. This will, so if you sit down in your chair, and I always recommend this for the hygienist or the assistant, even the dentist, sit down in your chair before anyone comes in. Look around. What do you see? What are the patients looking at? If you were a patient, what would freak you out, honestly? Do you see something like gauze sitting on the counter and you're thinking everyone who's been in here, all the aerosol is being soaked up by that gauze? So when you're really wanting your customer to feel, or your patient to feel really secure and they want to come back, especially now with everything heightened with infection control, their eyes are open. And then once they go in and they see how clean your office is, no clutter, you could smell how clean the office is. The patients will start talking to other people and it's going to establish a trust, and then they're going to want to come back because they know you're doing everything you can to protect them, protect yourself, and they're going to feel comfortable being there. And that's the biggest thing, is to ease that fear of your patients right now, and also your staff, to be honest. So how can we do this? The biggest component is to assign someone this task, an infection prevention lead. All the OSHA trainers, CDC, ADA recommend to have an infection prevention lead in your office, someone who's in charge of this whole gamut. So what are they in charge of? They would coordinate with the dentist or the office manager and collaborate with them on infection control recommendations regularly. So how would they do that? They would be keeping up with ADA, CDC, OSHA, and most importantly, the state recommendations. They would also be keeping up with all those manuals, like an OSHA manual, and also the guidelines. So the state one is the biggest one because that is where our license falls. So you want to make sure that minimally you're doing your state recommended laws. After they do all this training for themselves, they will hold an interactive team meeting regularly to level up the team on the newest recommendations, guidelines, and training. That person will also ensure that proper stock levels of PPE are available, and if PPE needs need to be replaced, such as those heavy-duty gloves. Those heavy-duty gloves are autoclavable, so that lead person will be inspecting them frequently for each person who has a pair, and then they would recommend to whoever does the ordering to order them. They would also figure out the fit testing for proper PPE if applicable, and then they would delegate who is responsible for sterilization testing and logging. So who's responsible for testing your autoclave, who's responsible for testing the x-ray unit, everything like that would be in one central location. Now, this does not come with no compensation. Typically, the person who's in charge of this is a big deal. So if you had a state dental board inspector come in, if you had one infraction, it would cost so much money, not only to your practice, but also the reputation of your practice. And then you would also have to go through infection control, continuing education. If you would apply one person who's in charge of infection control, this infection prevention lead, and compensate them for their time, not only compensate them, but you would, and that's on top of what they're already making, but that's also giving them a set amount of time per month, per week, whatever you decide is best, whatever they decide is best for the task at hand. Set aside time. If it's a hygienist and she's seeing 8 patients a day, boom, 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 and she has no time, then you would have to carve that out of her schedule. Same with an AFTA, same with an assistant. If it's the dentist, then you know how busy you already are. You would want to make sure that you're carving out time for everything, especially right now with all the regulations consistently being updated. You want to make sure that this person has the time to really stay up with everything, and also the time carved out in the team schedule to level up everyone. So this infection prevention lead is a critical piece of your puzzle to really keep your office leveled up. So what can we do moving forward? We could create a workflow and patient scheduling system that promotes safety and patients and employees. You can create an environment and level of communication that mitigates fear and communicates new procedures. Create a documented system that everyone uses and understands. And this also for the infection prevention person. Update that SDS, safety data sheet, for all products and store an accessible binder. And this piece is pretty easy compared to what we used to do a long time ago with all those paper MSDS sheets. Now it's an SDS. Typically the dealer that you buy from If you tell them, hey, I need an SDS on all the products that I've ever bought from you, they actually have an electronic version they can email straight to your point person, which is super easy. When I heard that, I thought, man, people who used to do this 20 years ago, I used to have all those sheets in a manual. They really make it easy now electronically. You want to make sure, again, that appoint that infection prevention lead who will oversee updating everything. And then you want to know the products intended for use and effects on your equipment and expiration dates. So you just want to make sure that everything is protected throughout this whole process, your staff, your patients, your equipment, and then you just want to make sure that what you're using on your equipment is appropriate. Right now, there's a lot of crazy things that people are trying to do just because they're so afraid, to have a cross-contamination issue in their office. So you just want to make sure, utilize that hierarchy, know that coronavirus and those type of viruses that are so low level are so easy to kill. As long as you're doing the right protocol with disinfection, PPE, just get the fear out of that and you'll be good to go. Thanks so much for joining us in Cave for our infection prevention webinar.